Dr. Frank Milnar. I practice in St. Paul, Minnesota. I've been a dentist for 47 years. I'm also a clinical mentor. I mentor pre-dental students, dental students, and clinicians at any stage. We'll talk about tooth wear. Besides dental decay, we see tooth wear every day in our practice. It's occurring in younger patients all the time. We have to have early intervention and know how to treat this. Our patients are expecting us to know about it and fix it so the teeth don't get shorter because part of their tooth is missing. 3 categories of tooth wear: attrition, erosion, and abrasion. We'll focus on attrition and get involved early with intervention and treatment. We see mild cases like this every day in our practice. Comes in different areas on the cervical, the incisal, the influsal. Now we have to know how to get involved. If we see severe cases of tooth wear in our practice, we can't be conservative anymore. Now we're extensive, aggressive, expensive, and the risk still is there for what happens to the tooth. Early intervention and treatment is the key. We do get involved with the incisal edge preparation, decay, or any sclerotic dentin. My friend and colleague Dave Clark said in the literature that you need a millimeter, less than a millimeter, at least 0.5 millimeters of countersink. And if you have decay, you have to go deeper. But we don't want to weaken the incisal walls, so we would like to create divergent walls to absorb the stress. And in this case, we're talking about today, we're not talking about bevels. So a minimum of 0.5 millimeters with a diamond, fissurotomy, burr, anything you want. Let's talk about the products and materials you need when restoring worn teeth. Shofu has the complete product line that you need to restore the worn teeth. BeautiBond, Xtreme, Universal Bond, a wonderful universal bond, Beautifil Flow Plus X, 2 different viscosities, Gymer chemistry, wonderful shades, Super Snap discs, my disc of choice, different sizes, different grits, no mandrel hole, it's my disc of choice, and OneGloss polishers, ideal for different shapes and different parts of the worn teeth surfaces. It's the disc I use. Beautifil Flow Plus X is highly filled. It's therapeutic. It's got the Gymer technology, antibacterial, acid neutralization, fluoride release and recharge. Just great. In the workshops I teach, this will be the one that will be simple, fast, profitable, no anesthetic. I'll use the caulk the window technique. We can restore 1 tooth in a few minutes or multiple teeth in a single appointment. Can maintain the function and arrest the wear. We can increase the height without affecting the bite of the patient. We can do this in 1 layer. Most of the patients in this category are 50 years and older. Patients are in your practice. This is minimally invasive. The composite maintains the wear, not the exposed dentin. They're very profitable, and the patients like it because we're not talking about crowns. In this workshop, it'll be simple, fast, easy. We're not going to use any bevels. Can be done in a few minutes. I'll show you how to caulk the window and how to keep the tooth out of occlusion. 1 layer, fast and easy. This is what a caulk the window is. People use caulking around the window to maintain an airtight seal, watertight, and that's what we're doing with our injectable material. This is a Typodont. This is what we're going to use to demonstrate the case today. If we do get involved in the incisal edge, we're going to clean out the groove using the burr, first of all to countersink, then lay the burr down horizontally to get rid of any loose enamel rods. This is what it looks like after the countersink and the burr. Use Mylar tape if you want to put there and separate the teeth. Acid etch. If you have a younger tooth with exposed dentin, you can do selective etch. Older teeth, more mature teeth, you can use a total etch because they have tertiary dentin. It's not like regular dentin. We treat it like enamel. BeautiBond Xtreme, 7th generation with a micro brush, 1 layer. Scrub it in for 15 seconds, air dry, light cure. 2 ways we can fill worn teeth. In this example, it'll be fast, easy, and simple. We're going to keep the flowable composite low and flat, keep it out of occlusion, 1 layer, no air voids. So you put the cannula from the Beautifil Flow Plus X with the Xtreme chemistry in one corner of the preparation, express the material out very carefully, just keep the cannula in the material at all times, and then gradually work your way back to the other corner of the preparation, just vibrating that cannula around a little bit, and then when it's completely filled, then you just snap, roll it out. So simple. Light cure for 30 seconds. We want to keep it low and flat and out of occlusion. Using the Shofu discs, perfect. The Super Snap discs come in different assortment, different grits, different sizes. We start at the top because we want to create a flatter top here. Maybe we're going to increase the height up to 1 millimeter or less. And then we would start on the incisal edge first, and then we go to the lingual side and make sure we buff that out it's a seamless transition. This is what it looks like. No voids. Now we're ready for final polish. Using the OneGloss by Shofu, the point where I would start is on the facial surface. You can use 1/2 RPM, that of the high speed. You don't need water spray to start out with. Very light touch. Just massage the area as a scout, making sure we have all the surfaces that are blended in together, that we can go on the lingual and then on the incisal. If you need to, you can put harder pressure with water spray actually to remove and texturize the surface further. So this is how we do the easy management of tooth wear. This is what it looks like. Thank you for the Shofu products. This is just an easy, profitable way for early intervention and treatment of teeth. Thank you very much. Thank you to Shofu.